Crystal here. I've had a lot of inquiries regarding foam rolling and postural support and foam rolling for mobility. So just a quick video. I like to start on my back. The foam roller should hit right between where the shoulders meet the neck. Make sure you're supporting your head. Engage your glutes to kind of push up into a bridge position. You want to very slowly roll back and forth until you've kind of met the end of the foam roller, or the end of your roll. Split your spine up into 3 sections. I like to do the upper back and the neck, the mid back, and the low back in 3 separate sections. So nice and gently roll back and forth. If it feels good to let your head extend backwards to reverse that forward head posture that we're in for the majority of the day, definitely do that. Foam rolling is not the most comfortable activity, but it shouldn't be painful. So what you should really be feeling is just creating some mobility through the spine and massaging out tight muscles. Now when you find a tight and sore muscle, stay on it for a little while and kind of focus on the area and roll back and forth short strokes. For the low back, you might feel like it's uncomfortable to go right in the middle of the spine, and so you can roll to your side back and forth. That will get more of the QL, quadratus lumborum, and the obliques. Good. Now if you wanted to do it parallel to the spine, to create a little bit more stretch through the upper pecs, lay on your back. Let your arms open up and roll side to side. You can also scoot the foam roller down a bit and let your head hang off the end of the foam roller. Open up the arms for just a nice pec stretch and that creating some mobility and flexibility through the extensors of the neck. Good. So now to the front. So you want to roll, not only are we worried about the back and the neck, and we need to create some flexibility and mobility there, but as we sit, our hip flexors get really tight and shortened, and that can create a lot of low back pain. So using the end of the foam roller, you want to place it right through the front of the hip, kind of like laying on the soft spot of your stomach, and roll back and forth. Now, I like to tell my patients, if you can commit to rolling a couple days a week, 5 to 10 minutes, you should feel quite a bit better. It's just going to create a lot more mobility through the upper back and the spine and create more comfort with sitting and postural support. Good. And then get the front of your hips, more of the top of the quad and hip flexor area. Now, you will be sore from this. Not only is it a mobility workout and works the muscle, and massages the muscles, but it also creates strength through the core. So there might be some bruising and a little bit of swelling from the foam rolling, but it will not do any damage. You cannot use the foam roller improperly. It's really just there to support the muscular mobility and function of the spine.